meeting. So the Girl Effect Country League Director sent her goodwill. The public holiday took it over. Noble Delta Women, who is their key friends, and then your interest also back to them. So the major reason for this TWG meeting is focusing on sustainability, because Girl Effect works in Delta State in 2 low-performing LGAs for the HPV vaccination. That's Ugwe and Ugele for 6 months, and after which they return again to scale up. During the scale up, the Ugele North and the Ugwe communities, they were able to reach out to the communities that were not part of the first phase of the project. Gavi 5.1 is coming to an end, and that should not be the end of the project. And that is the reason why all of us here will discuss how do we want to take this further without that funding coming. What are the opportunities? They have trained champions in community, the health workers they trained, then they trained teachers in schools too. So they partner with the Ministry of Education, the Primary Health Care, the Ministry of Health to carry out this project. So the resources that have been built, capacities that have been built, how well do we implement it, if at all funding did not come again? This knowledge, is it going to lose? Do we allow it to just die off like that? There is a Champions app that guides these sessions for nutrition and then the HPV. So what is the plan that the Ministry of Education has to scale it up to other schools that were not part of the first phase? And then the primary health care and the health workers at the local government level. What is our plan? How do we put all our resources, not just financial, human resources, together to make sure that our data that goes to the federal is being felt, and then we're also on the high scale, so that Delta will not be called as if nothing is happening here. It cannot just die. So that's the reason for this meeting. I want to implore everybody that it's going to be very, very interactive. Whatever idea you have that can make us to sustain this momentum, please put it up to the table. Once again, I thank you and welcome you all to this meeting. Thank you.
Thank you. So next on our agenda, now we want to look at 2026 priorities on routine immunization include by Girl Effect. So we are looking at cervical cancer. Despite our active of this training, coordination, and mobilize resources needed for success, we want to strengthen immunization system. We need to strengthen our immunization system, improve vaccine delivery, ensure cold chain efficiency. System. How do we do that? We need to improve vaccine delivery. We need to ensure that our cold chain efficiency and continuous training of our healthcare workers. Increase HPV vaccination coverage.
We have had too many technical working groups. Too many. We have not made one to work. Every day we gather technical working group for Dr. Income, technical working group for so and so, technical working group for education, technical working group waiting. We have the same people. Why we divide them? So, madam, that is our leader. What you were saying is right. And somehow, we don't want to die forever. And so we must come together so that on the other side of the world we also build a state. Or whether we will reassemble as Deltans and continue. So you know we like our vocal of us here. The Peace Association is a bigger one. Welcome you. Where are our police sisters? Yeah. You came there. You say, Michael, you don't know where you come from. You came here, you were saying, let's not tear the house, please. Eh? Because the last year, Abi, all of us understand. You have Adekola, right? Red Cross. Red O, their meeting, I was there. And they treated me very well. You know why I'm saying so? Because it's not working. If you see two problems.
Sustainability means the demands generation for HPV vaccination and nutrition services. So the Champions model, community mobilization platforms, and the school-based committee tools will become fully embedded within the government systems, to be embedded in the schools, in the community systems, and then supported by domestic financing, institutional leadership, and local capacity. So government will put in their resources in that basket our guy was talking about. Little resources because government will always say they don't have the money. Then community leadership will support, maybe mobilizing the people. We have cases before, even before the issue of sustainability comes, where you have community leaders saying they paid for a group of women to go and do cervical cancer screening, so that they will be sure that their community is free of cervical cancer. And that was very well, it was commendable during that time. So in practical terms, sustainability means that the state and local government leads the planning, the financing, and then the implementation of the Champions App project, vaccine, routinization, making sure that there is access to the vaccines at the local communities. Then the schools and communities continue to demand generation activities. They must continue because the 9-year-old girl maybe was in primary 6, has left for secondary, and now the ones in primary 5 that were not targeted are now in primary 6. So the school must sustain it. At least in Ughelli North, we have 20 schools that were reached. So if every teacher in that school continues, which we have just tasked them last week, that they must continue the outreach within the school, the awareness will be there. Then health workers, when they go for their routine immunization, when the parents come, oh, good morning, welcome to today's immunization. Let me know how many of you that have 9-year-old girls in your house. Then, ignorantly they will say, I have. Have you heard about HPV? Some will say yes, some will say no. So, have you vaccinated? After you have educated, bring your girls for vaccination. Tell them the benefits. Those kind of things is part of the sustainability plan. Then schools should try and institutionalize the Champions App in collaboration with the primary health care and SUBEB systems. So the SUBEB has been part of the educational system that was used, and they believe that it's much easier to route a program through them. So that's why SUBEB is talked about. Then the school-based management committee tools should be locally owned and adapted. And there should be monitoring and accountability mechanisms that will be institutionalized. So there is an M&E, there is state M&E, there is local government M&E. So those people should ensure that they are the ones checking whether the people that we have tasked to sustain these programs. Maybe because there is no stipend, because those champions to go to communities, there were stipends, there were refreshment. And probably when we are redoing it to sustain it, we are just going to ask them to go. If they are not lucky, because depends on the kind of funding that is available, their transportation may be made available. What if the transportation is not available? Did they really go? Since you are earning your monthly salary and part of your job was to go to communities to immunize people, when you get there, did you talk about HPV? How many HPV vaccines did you give? So there should be that mechanism to check those kind of things. Then HPV demand integrated into the routine immunization systems. I'm sure that one is done, but there must be a push for us. So why are we actually talking about sustainability now? You know, I talked about the Gavi 5.1 grant that comes to an end. Now that it has ended, how do we transition from donor-supported project model to a government-led system-embedded approach? How can the government help us? So, it is not an exit of girl effect from Delta State. There are other things to be done. If Gavi say we are not satisfied with the HPV implementation in the state, and we saw that there is an opening that maybe if you level up a little bit, we can still support, they will tell us and girl effect will return. So it's a shift towards state ownership, domestic financing, institutional integration, and then long-term adolescent health impact. Why are we developing a sustainability plan? One is to protect and consolidate program investments. A lot went into the Champions Act implementation. A lot has gone out into capacity building, knowledge management, and all that. So we must consolidate all these programs, these investments that have been made. Then to reduce long-term dependency on external funding. At every point that we are doing work, they have taught us. Trump has taught every country to try and look at domestic resource mobilization. Don't ever depend, because if some countries were only dependent on USAID, by now they would have packed up for their exit. There was no news, no information or pre-notice given to anybody. They just wake up that day, and that same day the work, all the funding stopped. So then it will strengthen state and local government ownership. We must begin to own up what we have. If the local government chairman can be brought on board, the chairpersons of the local government too can come to the table. The women, when they see the devastating impact of cervical cancer and HPV impact, they will call for the immunization of children, and they will want to own it. There is nothing wrong if it's their pet project, because I have not even seen a lot of those chairpersons saying this is my pet project. Maybe they just print exercise book and then go to school and go give to the children. A sick child cannot actually look at that exercise book. And they already have these children, they already have notebooks. As they start school, some schools, you just pay, they give them. So any notebook they give me in a party, I just give it out because it's giving me thirst in my house. They don't need them. So let them channel all these resources. Maybe by the time a coordinated effort is put in place, and what our chief imam was talking about, we can draft people from each of the local governments to join those your committee. Maybe one of them to represent the first ladies, chairpersons, and then the female vice chairman. Almost all the chairman, vice chairman in Delta State, they are women. So we should engage them in some of these processes. And then we will now align with the national and state health and education priorities while doing this. Then scale up and replication of the best practices. During the Champions App project, there were a lot of best practices. Like I said before, you see the men coming out to say, we are paying all of you go and do screening. Some places you see the community people gathering, where we want 20 we will have 100, because they say it's they have the education is power, information is power. And you see some of them saying that time we were coming to do that that first one we did was the takeoff now for HPV. You know, they were running away in the communities. Those men were coming back to say they regret ever telling their children to run away, that they didn't know that these were the benefits from it. So it really helped a lot, you know. So what does success looks like beyond this project? We are very optimistic that sustained HPV vaccine demand and uptake, government-led adolescent health programming, integrated HPV demand generation within routine immunization system structures, then institutionalized champions model, locally adapted school-based committee materials. They have a lot of materials that were developed. Then strengthened monitoring and evaluation systems for evidence-based scale-up.